But, it seems, things have definitely changed. It kind of, just talking to you, it makes me think of a couple unique patients or unique situations sort of going that above and beyond. I remember when I first practiced, my dad had said, Bill, there's going to be some times where, a patient's going to have an issue and it might be worthwhile to do a house call and see them at home. And so, seemingly this day and age, it's almost unheard of to do house calls. I don't know if you've ever done a house call.
I have not.
I think we talked about this. Were you with me when we were talking with Rob? Or I can't remember. Actually, we're having a dinner and we're talking about, crazy situations. I'm like, oh, how many house calls have you guys done? And everybody kind of looked at me like, what? Have you done it? Like, well, how have you done any? And I look back and there's been probably 4 times I can think of that I've done house calls for unique situations. So one of them was when my first year in practice. It was the day or 2 days before Thanksgiving, and I was about to fly out the next day. I was doing surgery, had one day of post-op, and I was going to go away to Thanksgiving. And I remember we got this snowstorm that had come in, and we had a foot of snow and, just blanketed the whole city. And there was one patient that was a very challenging case that I had the day before. It was this dense 4+ NS that I had to convert to extra cap. I had to put like 6 stitches in, and it was early case. I think I had an anterior vitrectomy. So I was like, I got to see that guy. His pressure could be 50 and what's going to go on. And so the next day, the whole town was more or less shut down. And, all our clinics had closed, except I think we had one clinic that was seeing patients, and it's downtown Cleveland. And so we called the patient. The patient's like, listen, there's a foot of snow on my street. I can't even get out. And he was about 80. His wife was there. And so I remember I grabbed my technician. I'm like, well, we can pick the patient up. We got my truck. I had his Jeep, and we drove down, got to his house, and he actually had a prosthetic leg, and so he's hard to move. So we put him in the Jeep, shoveled his driveway, put him in the Jeep, drove him to, I think we had to like help him get his prosthetic leg on. It's this whole thing. And then we get to the clinic, check his eye out, everything looks good. But that sort of experience, their whole family kind of saw that situation. They're like, oh my gosh, this Dr. Wiley like went and picked my dad up, took him to the clinic, made sure his eye was okay. And many of those family members are sort of my patients for life. One of them still gives me a case of wine every year just as a thank you for taking care of his father. So it's interesting, like those little things that you can go above and beyond that, that aren't expected really go a long way. And seemingly in this day and age where very few things like that are done, every little step means that much more. So there's huge opportunities to kind of do that type of above and beyond customer service.